Dr. Nowak has been kind enough to agree to come and spend the day with us today and talk with us about not only communicating science and health, which can be quite a challenge, but also the CDC, as I hope you have done, I hope you have gone to the CDC website and looked at some of the social media efforts that they participate in, and he is going to talk to us about those today.
Okay.
Great, thank you so much.
Sure. And I have a slight disclaimer. One of my colleagues who does a lot more social media than I do, was kind enough to put together this slide deck for me. So I'll use it as my guide. Folks in the social media part of CDC put lots of information in their slides, more than I would ever do. So I'll use these probably as a frame of reference. About 10 months ago, we had a reorganization at CDC, and we created two different branches. One is the branch that does media relations and media outreach, and another branch that does electronic and social media, including the CDC website. And so you may have, in some respects, more in-depth knowledge in some of these things than I do. So I will try to give you the 35,000-foot level view of some of the stuff, but my knowledge of some of the stuff into weeds is probably not as great as some of the people in this room. I want to start just by giving folks a sense of, we are a big organization, and we have centers, and the centers are kind of like colleges across the campus. So they mostly are independent and autonomous. When it comes to providing new and social media expertise for the CDC website, when you go to the CDC website, the home page, and probably the first level of pages, falls under the domain of our division of social media, or new and social media. So they're responsible for that. And so when you go to the CDC website and you see that front page, that falls into my jurisdiction as part of the Office of the Director of Communications. When you start going down into the CDC website, and you start drilling down 3, 4, 5, 6, 7 pages, you're now picking up content from our centers. And those centers have staff that work in electronic, new media, social media, as well as the intranet. And you'll see some variability. Some of these centers have more people, more resources, put a higher priority on things like new media and the web. And so you'll see more stuff in terms of web content in some places than in other places. It also means that you sometimes see, and we hope not a whole lot, of differences across different pages of CDC. We try as an organization to try to provide central guidelines and try to coordinate things and make sure people are all doing things in the same, so we have the same look and feel, a consistent brand. But there are undoubtedly some pages in some places that we've missed, or that aren't aware of those things. One of the first things I learned when I got responsibility for CDC's website and social media was that we don't have a central web content management system at CDC. And so we can't really tell you how many pages we have in terms of the CDC website. It's literally hundreds of thousands of pages. But they're managed very often by these different centers. And that can be a problem. It can be a huge problem. And so last year, for instance, when we had pandemic influenza and we wanted to update recommendations, we had to figure out who in these different programs at CDC might have some web pages with that content on, so we could let them know to change it. And so we're transitioning from a relatively outdated model of managing websites to managing websites the way many organizations do, which is having a software program called that does web content management. And you can imagine the transition, though, would not be simple and easy. When you talk about 400,000 web pages or 500,000 web pages and trying to transition them to a whole new website, that's not something that happens overnight. But that's one of the challenges we'll be facing in the short term, is doing that. But call this to your attention because there are different parts of CDC, and web content and social media reside at different places of CDC. We do use social media. We use it for a number of reasons. It helps us get our information out more quickly. It helps us reach more audiences. There are a lot of people who rely on new and social media as their way of getting information. And so we are in a lot of different new media spaces. It has helped us reach audiences that we traditionally don't reach. A lot of people 45 and older, for instance, read newspapers, watch television news. A lot of people 35 and under don't. And they're using new and social media or portable media. And so we have to be where a wide range of people are. One of the benefits of social media is it allows us to tailor messages and better target some of our messages. It can be a challenge for an organization like CDC to come up with one-size-fits-all recommendations because people are different, their health issues are different, what they're exposed to is different, and so this helps us in terms of customizing messages. A lot of people want interactivity, and a lot of these tools provide a way to interact, and they facilitate two-way communications. We know, and these are some recent statistics, a lot of people use these media. Now, one of the challenges with these statistics is they don't sometimes tell you how much they use them, but you can see a remarkable number. 91% of Americans subscribe to a mobile service. There are 1.56 trillion text messages sent every year. You can imagine the clutter, and you can imagine that many of them are, "What are you doing now?"
I think my daughter sends most of them.
Well, in fact, one of my staff members said to me about a while back. She said, "My daughter, who's now I think she's a junior in high school, she's like, I look at the phone bill. She's like, she has 20,000 text messages in a month. How is that possible?" A lot of Americans are using mobile devices to access the web, and that really, for a lot of places, a lot of agencies like CDC, that's kind of a new frontier and a whole new set of challenges. When I first joined CDC 12 years ago, one of the scientists said to me, why do we need to devote a lot of time and resources to the web? The web is just a passing fad. It's going to go away. Well, he turned out not to be a really good forecaster of the future. The web is with us. A lot of my colleagues at CDC understand that the use of these desktops, and they use these desktops, and they know these desktops are really important. Turns out that a lot more people, though, are going to smaller media, iPads, Blackberries, and that's how they're accessing the web. It's not a simple matter to just use this platform, this look, and pull it up on a cell phone. Rather, you have to reprogram and you have to restructure how you present information. And for a lot of organizations, that's a revelation because they've made an investment in being able to develop this look, this desktop look, and now you have to tell them, now we need more resources and more programmers and more people to be able to translate this desktop into something that would come up useful on a cell phone. But a lot of people are, and as this number grows, and apparently there are parts of the world where this number now is over 50%. That's the primary way of accessing is portable devices. There's a lot of online video sharing, a lot of people using social network sites, blogs, a lot of blogs. One of the challenges with blogs, there's a lot of them, and a lot of them have relatively small audiences, and so it can be hard to figure out where they fit in the big scheme of things. And then podcasts and other things. And believe it or not, people actually listen to CDC podcasts. I was skeptical. I thought, who's going to download, a 3-minute or 4-minute health message? But we do have about 50, 60,000 people a month who will download and listen to, podcasts and health issues.
How many of you remember Kaylee Dugan, who just graduated in August? Her mom actually does the podcast for Charlotte Dugan.
Ah, okay.
Podcast, right? Her daughter just
Yes.
graduated from our program.
Ah, terrific. Okay.
Just thought I'd throw that
There
in.
you go. We know, one of the biggest reasons that you have to be in all these places is that people have to see messages in different places. You have to build repetition. That builds credibility. That helps persuade people. If you're in the health promotion, disease prevention business like we are at CDC, you're trying to get people to take actions. And that means that people not only have to get these messages from experts, but it turns out that very often they also have to hear it from family and friends. That those are also key influentials in terms of whether you get a flu shot, whether you do a preventive behavior. It's not just the experts. People hear from experts all the time, and while they're important, they're not the only way to get messages. We at CDC use social media because we want to engage in dialogue and two-way conversations. A lot of the government not just federal government, but state governments and local governments are trying to figure out how they can use social media as a way to get input from citizens, particularly on challenging issues. That this can be one way of kind of like an electronic town hall meeting where people don't have to come to some site physically, but they can use these kinds of media to get feedback on things that are being considered, to get input from citizens. It can be challenging. If it works and it works well, that means you get a lot of input and a lot of messages from citizens. We have struggled with what do you do in terms of replying back, because most people want an acknowledgement. And if we got, say, 20,000 replies, that's a lot of replies to reply one by one by one by one. And so some of this, you lose some of the ability because you have to come up with other ways, like using software to reply versus people to reply. And again, the whole idea is probably best depicted in that bottom slide, is you're hoping that your message to one person will reach a few other people, and then it'll mushroom out and reach even more people. And you see that with things like Twitter. I mean, that's the idea behind people who are using social media, is that your message goes to a handful of others, and then they broadcast it out to others, and over time, you reach a large number of people. We also know, as I just mentioned, that you have to have multiple information sources that enhances credibility. There's been some research as to how many times people need to hear something before they believe the information is likely to be true. As you can see, it's very rare that you hear something once or twice and you think it's true. You really have to create the perception that it's a social norm, or a lot of people are believing it and talking about it. And again, you're talking 4 to 5 times, 3 times or more. We do a lot on CDC's website to try to facilitate information sharing. So if you go to our website, you will see all these icons and all these different possibilities. So people can go to the CDC homepage. They can click on the Twitter icon, the Facebook icon, the MySpace icon. People can sign up for information from those various channels. In media relations, one of our most powerful tools is this little RSS feature. We have used that in media relations side of the fence to get subscribers to a number of things. So we have an African American media resources list. We have a Hispanic American resources list. We have a number of people who subscribe to our story ideas. We every week update new possible story ideas. We have a list that pushes out what look like press releases, or what we call MAT articles. They're actually formatted articles, and we want people to use them. And so we started with this as kind of a pilot, and we now have 50, 60,000 people and organizations that subscribe to this stuff, so that when we put up a new article, it automatically gets distributed to those 50 or 60,000 subscribers. And so we have found this to be an enormously helpful way of getting our materials and our messages out to different segments, different populations, different publications, as a way of increasing the visibility of CDC's messages. We have a YouTube channel, which enables us to post materials on YouTube. And again, I must admit, I was somewhat of a skeptic when we thought, who comes to YouTube to watch health education, health promotion videos? But for flu, we had a few million people come and look at CDC materials related to preventing influenza. Got more people viewing it on YouTube than actually viewing it on our website. And so, again, not something I would have anticipated. So, an overview of that. Portable content. As I mentioned, this enables people to interact beyond our website. So H1N1, good example. We did a lot of things with H1N1 in terms of new media. Our H1N1 flu video, 160,000 views on CDC TV, 2 million views on YouTube. So a big difference in terms of viewership. We know many people want to know when we have updated our content. A lot of health departments, a lot of partner organizations look to CDC's website for information. And so we have used our website, and particularly new media, to let people know when we have added new materials, added new content. Again, trying to provide content where people are. And you can see that screen much different than a desktop, and so trying to make our content user-friendly for these smaller formats takes time, effort, imagination. Duplicate, sorry. Some of the things that we do in terms of people saying, you know, let's get involved in social media, or I want social media as part of a campaign. One of the attractions to many people when it comes to social media, many people inside of an organization like CDC, is they're interested in social media because they perceive it as being pretty low cost. You know, they may not have the money to do a public service campaign. They may not have the money to do buy advertising on television, develop posters, but they see social media as kind of a, well, you know, it looks like it's low budget. and if we just bring in somebody with the right skills, we can do this pretty easily. If only it was that simple, right? Even if you're using social media, you have to have good content. You have to have interesting content. Your videos still have to be videos that people are going to want to watch. Your podcasts still have to be ones that people are going to want to listen to. So you're competing with a lot of people. The cost to do this stuff may be less expensive, but you still have to be smart about it. So what we ask people to do is think about why and how they're using it. What are you trying to accomplish? You know, what's your hope is going to, what do you hope is going to happen if you start using social media? You know, what are your messages? What are your communications objectives? What channel? Which of those various tools are you going to use? Or do you think you want to use? And why? Is another key aspect. What do we know about how people use those media? Are they using those media in the ways that you envision? I mean, a lot of people think, well, I'll just send out a tweet. And it'll go to, you know, this many people, and that many people will send out to that many people, and pretty soon it'll be around the world, and everybody will have got my message, go get a flu shot. And so you have to ask, well, is that realistic? Is that really what's going to happen with your tweet? And who are you going to send it to? And then the level of engagement. One of the challenges for government agencies, government organizations like CDC, is that a lot of social media, why do you use it? What's one of the reasons you would use social media?
Convenience.
Convenience is one. But what do you hope happens if you're using some of these things? Why are they called social?
Interaction.
Yeah, you're hoping for interaction, right? And so that can be a challenge for an organization. Because one, what happens if, you know, a few thousand people take you up on the offer?
You can't interact that.
What?
You can't interact that.
Yeah, it makes it hard to interact. So you're using a medium that is personable, customizable, you can tailor your messages. But on the other hand, if a large number of people say, sign me up, or I want to start talking to you, that can be a challenge, right? If you're a government agency, or even if you're a for-profit firm, what do you value as if you're in the audience and you're using social media, what do you value as a recipient of social media messages? What kind of content are you looking for?
Brief.
Right? Brief. And sometimes government agencies and organizations can't be brief. Right? They want to tell you everything they know, right? What's another thing you're looking for as a user?
Interesting and relevant.
Interesting and relevant to who?
To me.
Yeah, to you, right? And so a lot of times that can be a big hurdle because agencies and organizations want to be interesting and relevant to who? Themselves, right? They look at the information and go, gosh, this is really interesting to me. It ought to be interesting to you. And it may not be, or it may require rethinking about how I talk about it or how I present that information to make it more interesting to an audience member. What else do you look for or expect in interesting content? So you expect it to be interesting, you expect it to be relevant, you expect it to be short. Anything else?
Accurate.
Okay, accurate. Although the web is not, a lot of these media are not necessarily known for their accuracy, right?
Responsive to feedback they've gotten.
Okay, responsive, right? So you want some indication that the person has read your response back, right? And is giving you good feedback. Let me go back to interesting for a second. What makes it interesting? I mean, what separates content, interesting content from not interesting content?
Informative.
How so?
I find content that I can share with others, that I can help spread a message. I find that really interesting. But that might be different from someone else who wants it really relevant to a cause that they're dedicated to or something.
So yeah, so it gets back to, it speaks to you. It's in words and language and uses frames of reference that you that like, resonate, understand. Yep.
I like to see sometimes what I'm going to get out of it. Like a for-profit might put up a coupon on their Facebook that you have to show the picture or something to get like a percentage off or something.
Yeah, that's a great one. What's in it for me, right? I mean, you see a lot of places using social media, and one of the ways that they try to attract audiences or users or followers is they provide something that's in it for you. And in the absence of that, it's much harder to engage people. There has to be some, I see the benefit. I mean, I understand why I should be following this, using this. And that can be really tough for agencies and organizations because all they may have to offer is their information. And there may not be much in it for you. And so that's a really important element here in terms of that. Controversial information, right? Breakthrough information, unique stuff, things you've never heard or seen before. All that makes information more compelling, both for you as a user to want to read it and to share it. And that can be really a challenge for many organizations. Our information, we may think it's really great and you ought to know it, but when you look at it, you may go, kind of dull. I mean, I don't understand why, I should really feel excited about that. I don't understand why I would pass that along to somebody else. It may be important to you as an organization, but not important to me. All those things that make, the stuff that we read about that gets lots of viewers, lots of pass-alongs, is really hard at the end of the day to generate. And it can be really hard for organizations, whether they're a for-profit company or a federal government agency, because chances are a lot of those messages and those materials are kind of edgy. They've got a really compelling offer. They got something significant in it for you. They may be controversial or involve controversial topics. They may be topics that are politically divisive, right? Because politics, a lot of organizations use these messages to send, messages to their followers, and their followers are rabid and they want more stuff, whether you believe this or whether you believe that. All those things make it harder for agencies and organizations, including government agencies, to use this and use it well. So it may not take as many resources as people think to get started in this game, but if you want to do it well, and if it works, and you start engaging large numbers of people, guess what? It's going to take resources. It's going to take somebody who's reading all those materials, responding to those materials. And like I said, the idea for a lot of this is participation, and that's where people don't see the resource needs coming. This is a snapshot of the many things that we did or we do with seasonal flu in terms of the social media world. And so we have text messages, helping people, trying to encourage people. We do video as part of CDC TV. And that there's, as much as we can, we try to make them short, interesting, compelling. Many of them speak to a professional audience. Some of them speak to a public audience. We have used widgets, and widgets have been, as I mentioned in a couple other presentations, one of the most powerful tools that we've had at CDC. A lot of people love to put widgets on their websites and in their social media, and so we've had a lot of success in getting other people to take these things and put them in their places. They've helped us increase the number of people coming to the CDC website for information. And again, they're relatively inexpensive to do. Now, one of the challenges we have as an organization is many parts of CDC will come to our social media group and say, I want a widget. Could you produce it? And so if enough places want widgets, you can get caught up doing nothing but doing widgets. We do a lot of tracking, because when it comes to social media, one of the things that you find pretty quickly is people want to know how many people have seen or potentially have seen your messages. One of the nice things about a lot of social media is you can count those kinds of numbers, and so a lot of people like the fact that you can count things and you can present things. You got to be careful, because do these numbers mean that you've taught or educated or made all those people aware? No, but it gives you a sense of how many could have become aware. As I mentioned, RSS feeds, a tremendous tool in terms of getting things, but widgets, 5.7 million people have seen CDC widgets. And then going all the way down, you see some of the smaller things. We have about just over 1 million Twitter followers. Hard to maintain because, again, we have to come up with interesting, compelling content.
Your main Twitter feed?
Hmm?
Is that for your main Twitter feed?
This was just for flu. Yeah, these were the flu-related ones. And again, for flu, it was, when you have pandemic flu, it was somewhat easier because you had new developments, you had new recommendations, and so you could update your messages, you had new messages. Now, this time we're back into normal seasonal flu. At the beginning of a flu season, you probably got some new messages, but when you're week 16 in the flu season, your message is still get a flu shot, get a flu vaccination. So your message, it's easier when your messages are evolving than if they're static. A lot of organizations, including the White House, use Flickr. And the way they use Flickr is they post images there, pictures and video, and then they let media know that they can come there and get those images and they can use those images. And so that's a way of getting images out to the world. You can do it in other ways, but I know that many are using Flickr as the way of getting images out to the world. Makes sense for the White House because they for many instances, there's not a photographer there from the media to take a picture of the president having a meeting with somebody from another country. And so they can have a White House photographer take those pictures, they can put them on Flickr, and then media can get those pictures and use them as they want. As I mentioned earlier, mobile is probably the one that we're trying to figure out, where do you go with mobile? Mobile is probably more for CDC in the research and development stage. A lot of statistics out there that say, here's why you should be worried about it or want to get into it. 270 million US mobile subscribers, 87% of the US population. A number of people, I think 25% of households no longer have landlines for phone. And so the only way to reach those people is through mobile devices. And there's this notion, or early on, there's this belief that you get deeper engagement if you use things like mobile technology. Everybody has phones. Our people at CDC go throughout the world. And in the developing world, this has become one of the most common media. They can be relatively inexpensive to distribute. And so you can get to people. You can give phones out. And so a lot of organizations, as part of their interventions trying to reach people, have given out phones and given them access, some number of hours of use so that they can access them. Then there's some weird stuff that we find at CDC. Today we had a news briefing on a publication called Vital Signs and looked at binge drinking. And so we gave an update on how many high school students, how many adults binge drink. And binge drinking is defined as if you're a male, you had 5 or more drinks in a 2 or 3 hour period at least once in the past 30 days. If you're a female, you had 4 or more drinks at least once in a 2 or 3 hour period in the last 30 days. Probably nothing any of you have ever done. But one of the things that the researchers did, which was hard to make sense of, is because 25% of Americans don't have a landline, they only have a cell phone. There's been a lot of effort to look at how do you talk to people, how do you survey people who only have cell phones? Much harder to do. And in this study for binge drinking, they had one sample, it was about 450,000 people. That sample that was people who had landlines. They had an actual phone line in their home. They also did a separate survey of people who just cell phone users. And they found they had 15,000 people there. But what they found is, and what we've been seeing, is much different results based on cell phones versus landlines. So the first thing you think of is what? I mean, why would you expect cell phone users to be heavier drinkers, heavier smokers, less likely to get a flu shot, more likely to be tested for HIV? Why would you expect that? You would think younger, right? And while there's some evidence that's the case, it turns out the demographics of these two groups are actually pretty similar. So it's not something that CDC has quite yet figured out. But you do see, sharp differences in terms of behaviors among people who have cell phones versus people who have landlines. And it's not mostly explained by age. And so don't know if cell phones cause those things. So if you buy a cell phone, you're more likely to want to drink or smoke. So one of the things that we did do recently is we pilot tested to see would people want to get health messages sent to them through mobile devices. And we had a number of people who signed up. We signed people up. They got 3 or more messages per week. And then we looked at what happened. And as you see, at the end of the study, about 16,000 people signed up to get health messages from CDC on their cell phone. Pretty much every social media, we have a Facebook page. And so you can actually go to Facebook and you can find the CDC page. We have a presence in MySpace. Facebook, we tend to find that we do get younger viewers. It could be the same content you see in the CDC website, repurposed, made more user-friendly, but it does reach a different audience. Our Facebook page does not have as much content as the CDC website, which can actually help it in terms of getting people to want to use it. In terms of our Facebook users, they spend about 55 minutes per day on Facebook. They interact with the CDC website pretty frequently, or the Facebook site, so that's good, a high level of interaction, more in-depth interaction than with the CDC website.
So, when I just go visit it and read it, that doesn't count as interaction. I have to actually post something to be considered interacting on Facebook?
Yeah, but this data just shows that most people are doing what you're doing, reading it,
Okay.
and not interacting with it. The other thing that another interesting finding is we've done some studies to see if people engage with us through social media, does that make a difference in terms of what they think about our website? And it actually does, which is kind of interesting, that the people who are using CDC social media channels actually think more highly of the CDC website. They have higher satisfaction ratings. They're more likely to return to that site. They're more likely to recommend the site. They're more likely to see the site as trustworthy. So you do see some other benefits of being involved in the social media world. This is an example of Twitter and some of the things that we have done in terms of Twitter. The earthquake in Haiti, there were people from CDC who were sent to assist. And so one of the ways they kept people abreast of what was happening was using Twitter. Again, it gets back to if you give people something to do, something real to do, that could help them improve their health, reduce their risk. That's empowering even during a difficult situation. We did see people tweeting about H1N1, about vaccine availability, about resources that CDC had. It helped in terms of getting more presence in terms of what was trending. Let me just see some of these other things. I can tell our social media people love data. We have done some things in virtual worlds, Second Life being one of them. Somewhat controversial, including internally at CDC. There are people who want to know, why are you in these make-believe worlds? Shouldn't you be more in the real world? And so that can be a challenge. It's also been, trying to figure out how many of these things that are modeled in these virtual worlds actually people do in the real world. And so there was some data that talked about, I think, something like 33,000 avatars got a flu shot last year. But what did that translate into in terms of the real world? And so it turns out that about 6,000 of the people behind those 33,000 avatars got a flu shot. So there was an attempt to sort of get a sense of, is it just happening in this, virtual world, or is there any carryover into the real world? But that can be hard to establish, and a lot of people want to know, is there any relationship, or what is the relationship between what happens in these virtual worlds and what people do in real life? Yville was another. And so, yeah, Yville was the one. So behavior changed in Yville during the 2008-2009 flu season. We had 33,000 of these avatars visit the vaccination station, 9,000 virtual vaccinations, 385,000 virtual hand washings. And again, why does it all matter? Well, you know, it matters because of the bottom line. I mean, did people get, in the real world, did it affect their behavior? The YouTube videos, hard to evaluate. And one of the challenges with a lot of social media is that the cost of doing these is probably a lot less than the cost of evaluating and seeing what happened. If you want to see what happened, it's probably going to take more money, more time, more resources than it is to do the actual video. And so for some of these things, one of the reasons you may not do a formal evaluation is that it's not cost effective. And you would assume that, you know, at the very least, this is going to at least help you. It's not going to hurt you to do these things, but it can supplement what you're doing. But if you wanted to establish how much it's helping you, that's a much more difficult thing to do. I mentioned widgets. Lots and lots of widgets, from interactive ones where you can actually see how much you know about flu, to we have used widgets. Turns out when there's big flu epidemics, a lot of people come out with products that they claim will help you prevent the flu. Everything from body wash to gels. Most of them, none of them work. And so letting people know. We early on tried to get a lot of messages out about hand washing because there wasn't vaccine. And I think one of the things that we did see last year is that the number of Americans who said that they wash their hands on a regular basis went way up. And so a lot of those efforts related to hand washing did pay off. We have used them in foodborne disease outbreaks, and we've also tried to help people know what products have been recalled. And again, these things get picked up and posted on a wide range of websites. Let's see. And the last thing I just want to talk about is content syndication, which is probably not one that's very obvious. But this was developed because a lot of people come to the CDC website, cut and paste our content, and then put it on their website. And we want them to do that. But the problem with that method is that when they do that and we change our content, we don't know who cut and pasted, and we have no way of letting them know that we changed our content. And if you're a health department and you cut and pasted some CDC content and put it on your website, unless you keep coming back to our website to check to see if we've changed it, that can be, you know, you may have out-of-date information. And so what content syndication is a method where somebody can subscribe to web pages or web content on the CDC website. They can take that information, they can put it on their website, and when we update it, it will automatically be updated on their website without human intervention. It's all done automatically. And that's a huge breakthrough because it means that a lot more places can use our information. A lot of health departments that may not have big staffs to do web content can use more of our information, and they can use it knowing that if we change it, it will be changed on their website, and they won't have to worry about their information being out of date. And so we now have over 300 health departments that are subscribing to different content on the CDC website. E-cards, we have used e-cards probably for the last 3 years. And one of the reasons we use them is because the American Greeting Card Association says a lot of people like them. We have used them for a wide range of things. And again, one of those things hard to evaluate, but we do know that people keep using them from our website. We see people downloading them and sending them, so we've continued to provide them. Let's see. I mentioned this one already. Obviously, the age of Facebook fans at CDC, much different than the people who use our website. Our typical website users are 35 and older. And as you can see, our Facebook users much younger, which would make sense. And it's also heartening to know that, you know, we can reach younger audiences if we use these media. Let's see. HIV, a recent campaign. It's called the I Know campaign. And again, a lot of this campaign is grounded in social media. Because again, the audience we're trying to reach are young Americans. And so this campaign has got just about every element of social media built into it. 10 years ago, we probably would have been using public service announcements for a lot of this and trying to reach people through public service announcements or donated media time. As I said, more Facebook, video, people becoming fans. It's also one way to engage others like celebrities, to get them involved in campaigns in kind of an interactive, low-cost way. And so there were a number of celebrities that were involved in the I Know campaign. And so the last thing is what is our kind of broad strategy? It's, you know, trying to track audiences, find out what audiences are using what media so that we know the different channels, figure out our communications objectives, figure out how social media fit into an overall communication strategy, look at the resource needs, which is that fourth step in terms of preparation. What is it going to take to make this work in the social media world? And do we have that skill and expertise? What tools are we going to use? Developing those messages, and then launching those efforts, and then tracking to see what happens. And again, if you go to our CDC website, a lot of the most recent campaigns, you can find the different components. And then these are some of the main links. So I wanted to leave plenty of time for questions. And so questions, comments, thoughts, suggestions?
Do you have a whole social media department for like every different organization within the Center for Disease Control?
What we have, I guess, it's both centralized and decentralized. And so there's a branch or group of people who is in my division, and they have expertise in social media, and they do some of the social media for the agency as a whole, for the entire, you know, for the kind of the broad picture CDC stuff. They also try to develop guidelines and trainings for other parts of CDC, so they can, you know, say, here's the kind, if you're going to use these media, here's the guidelines you should follow. And if you want training in how to do these things, we can provide training in how to do these things. There's not enough people in that group to be able to take on all the different projects people at CDC want to do in the social media world. And so they have to kind of pick and choose which ones are going to have the biggest payoff. Some parts of CDC, like the HIV/AIDS campaign, they had a few $1 million to do that campaign. And so they brought in an outside organization, outside agency, to do a lot of the social media component of that campaign. So you see it done that way. And then there are some programs at CDC that have hired people to do social media and to get involved in social media. So it varies across the organization. Yep.
How often do you like check the metrics of like the social media efforts? Like, is it something that has to be tracked like monthly to see if it's being, you know, like useful, or I mean, is there like a good amount?
Yeah, good question. And it's tracked pretty regularly. It's weekly and monthly. Some of them are assembled monthly, and so the CDC director is real interested in what's happening on the social media front. So there are some things that, like, you know, visits to the CDC website and what pages are most popular. Those things are tracked on a weekly basis. And then there are other things in terms of like podcasts, some of the different social media sites. Those are tracked on a monthly basis, and people get reports as to, you know, who's visiting, what do we know about these different tools.
Reports are, I would imagine, are probably pretty internal and expensive just in terms of how many views you're getting on certain sites and stuff. But in terms of big polling, like with all the statistics you were talking about, does the CDC employ a polling company to come up with all this data? And that's really expensive, isn't it?
No, in fact, going back to the last question, you can actually go to our website and you can see a lot of this data. So if you're interested in seeing what some of our metrics look like, we actually post it. And so people can actually see. In terms of surveys to get a sense, most of that is done by the different centers and the different programs, and they'll do it on specific issues. Occasionally you'll see a national organization like the Gallup organization or Harris do some giant survey about different government agencies and what they're doing. But we generally don't spend a lot of money at CDC doing those kinds of things. But it is amazing when you go to the site to see, as you can see, these are, you know, not user-friendly versions for PowerPoint, the data that we gather. And you can see, you know, all the different places that are visited, which are most popular, how many people are using different elements of it. And again, it gets back to because if you can count stuff, people like to see, you know, how many. Other questions?
Surely there must be other questions.
So what do you guys think about the use of social media for health and disease prevention? Good idea, bad idea, something that you see has much future? Is it something that you guys use, see your friends and others use?
I just feel like the older we get, the more we want to be involved in stuff like that and know what's going on. And for me, I feel like Facebook's a great way to know easily, like have easy access to stuff like that. Like I've been joining lots of groups in the past couple of years instead of just like stupid groups like.
Because I mean, one of the assumptions, one of the assumptions organizations like CDC and others are making is that, you know, folks like you who are in the audience are going to come to this content, that you're going to find it to be useful, and that if it's packaged right or presented right, you know, there is value here. And I'm interested now, what do you think of that theory, of that idea?
I think that there's definitely some truth to that. I didn't even know y'all were on Facebook because I never thought to look for it. Now, I mean, I want to go look and see what all's on the page. It's just getting the word out that y'all use those certain things to those that are unaware of it.
Okay. And now do you think, though, I mean, we're in competition, I guess, with the entertainment sites and the sports sites and all those things that, you know, have, you know, for many social media, you know, you can get nothing but Atlanta Braves information, and you know, 24 hours a day, 7 days a week.
I think that found interesting was, I believe, was co-sponsored by MTV, but you would go on Foursquare, and if you got STD testing, you could check in as getting STD testing and earn a badge for that. And I thought that was a really neat way to get more people to go and do that.
But what are your thoughts? Easy thing to do? Hard thing to do? Use these media for disease prevention, health promotion? Yep.
Especially with the retweet function on Twitter, like if I followed CDC but none of my friends did, and I saw something interesting that was pertinent to my age group and retweeted it, you know, then they see that I value it enough to share it, and it's like, oh, maybe I should heed this information. So, you know, if it's coming from a peer as well as the powers that be, it might be a little bit easier to listen to.
Okay. Well, take a real-world example, and I'll just throw one out. The research we released today on binge drinking, one of the things that struck me when I saw this research was the percentage of high school students who said that they binge drink. What do you think it would be? Any guesses? Give me a number. What percentage?
30%.
This is based on observational data, right?
Yeah.
What you observed when you were in high school, right? No, it was 40%, and that struck me as a really startling number. Because one, it's illegal. It's not legal to drink if you're under 21. These people are way under 21. You know, it's not like we're talking 19, 20, and 21-year-olds. So if we wanted to, if you were asked, you know, is there a way that social media could be used to try to have an impact on reducing the number of high school students who binge drink? What do you think? What would your thoughts be? Definitely? How so? I mean, I'm just, there's no right or wrong answer here, so it's not like I'm
Off the top of my head would be to show YouTube videos of graphic consequences of what happens if you drink and drive, for example.
Okay, so you could use YouTube and put up videos, right? Now, what would it take to make those videos effective? They'd have to know they were there, right? Right, so you'd have to create some way of letting people know they were there. Other thoughts? I mean, like I said, there's no right or wrong answer. I'm just curious to see.
It has to be more personal, because I know a lot of friends from high school that would they don't really care unless like someone they know or they have been affected by binge drinking.
So how do you make that happen in a social media world?
That's hard.
My high school, they showed us videos of like horrific, like scare factor type stuff, and you could make that more public than just to one high school. That worked for a lot of people, like the scare factor of what could happen, even if it hadn't happened to anyone that you personally knew. Seeing actual people and actual pictures from accidents and stuff like that had a big effect on me. Like I still can't get some of them out of my head. That was like 8 years ago.
Okay. Okay. Other thoughts?
I think that you'd have to build relationships with organizations or high schools in which there are some students who have jumped on board and who are maybe like against teen drinking or binge drinking or drinking and driving. And that way you've built a relationship with kids of that age group and they can disseminate the information for you. So I think it's about relationship building to your target audience first.
Okay. Yep.
I think that cliques are kind of a big thing in high school. So if you maybe sort of focused on like the different types of cliques that are in high schools, then everybody can kind of relate to one subject, because a lot of people in high school think that maybe the jocks are different than the punks or something, just whatever. But if you kind of show people of different, I don't even know how to explain it, but just of different cliques, kind of coming together, talking about how they all drink and the dangers of that might kind of target everyone.
So what social media would you use, and how would you think about using
I
it?
think the viral videos. I mean, you can see even on Facebook, somebody can post a video, and immediately after maybe a couple minutes of it being posted, it's on 5 other people's profiles. Because they're just an easy button to share. To immediately post it in your profile. You can post it if you have certain sites, specific sites that you run. You can post it on those as well. So it's just, I feel like that's the quickest way.
And then who would create that video that you would, who creates that first video, the viral video? Who needs to create that?
I mean, even like contests, like I think somebody said, what would they get out of it? I mean, contests are a great way to kind of build participation in stuff, because if somebody's going to get something out of it, like you create this video, and if you create the best one, it's going to be featured on our site. I mean, then I think people from all over the country would create their own videos, and people could vote on them, and that would just build a lot of interaction.
And so we would reduce binge drinking by bringing people's attention to the video. The video would have the messages, right? And then the messages would be the thing that would persuade people to not do it, right? Okay. Other thoughts? Yep.
I know working as a peer health educator on campus, they've been training us when we go to the classes to start transitioning to speaking not as far as the scare factor, this could happen to you, but more empowering people. Take this information so you can look out for your friends, and being sort of an empowered bystander, although it might actually affect them too, but that way they have the information, and encouraging them to reach out to their friends as well. So I guess if the video was targeted towards, learn more about this, so if you see a friend drinking this much, that you can tell them, hey, that's a little too much, something like that.
Yeah, I mean, what you're seeing here, this is pretty much how the process works in the outside world. Somebody, like from our alcohol group, will take this data, and they'll come to some group of communications experts at CDC, and they'll come and say, I need a press release, or I need a social media campaign. And then they'll walk away. And it's like, so you health communications people, just do your magic. You do your hocus pocus, you wave your magic wand, and voila, you've got a social media campaign. And then we just go implement it. Much, much more difficult than that, right? I mean, so if I came to you as a client and I said, 40% of high school students are binge drinking. I need your help. I think social media could be helpful in terms of reducing that number. And so if somebody came to you, then you have to think as a communications specialist or a communications expert, first you want to get them to define their objectives. And so what do you hope is going to happen as a result of the social media campaign? And I might say as a client, well, I want that number to go from 40% to 35% in 12 months. Make that happen. That's the easy part being a client. You can just pick a number, pick a time frame, and say go for it. The devil is in the detail, or God is in the detail, however you want to look at it. There's a lot of details that are going to make that happen. What next? So if somebody said that to you, said, I want to do this, or I want you to do this, this is my goal, what are some of the other questions you would have to ask the client in terms of, being able to kick this kind of an effort off, a social media effort?
I think one initial problem you're going to have is that research generally shows that the very target audience you need to reach will be the one most reluctant to receive that kind of information. So you're going to have to look for another way, as one of the students said here, kind of come in a back door from some sort. And that's going to be quite a challenge. Binge drinking is a big deal.
Yeah. Well, it also illustrates one of the other things you're going to want to ask the client is do you have any data? Do you have any research? Have you done any research among this audience? What do you know about high school students and binge drinking? What can we learn about high school students and binge drinking? The other part of that equation, the other part of your research effort or your preparation effort is, what do we know about high school students and social media use? What data do we have about the social media they're using? Because you're letting me get away with a lot of people do, which is use the word social media like we all know what I'm talking about, right? I mean, it's a big term, encompasses a lot, and so you want to pin down the client and say, what's your definition of social media? What does that encompass? You want to think yourselves probably more broadly, at least initially. You want to probably think wide rather than narrow. But you also want to be able to look at, what's going on among high school students, and both in terms of binge drinking, why they do it, what motivates them to do it, what's the difference between the doers and the non-doers. And so a lot of times we do research in public health to figure out what distinguishes those who do from those who don't, whether it's get a flu shot, don't get a flu shot, binge drink, don't binge drink. So one of the first things you want to do in terms of research, whether it's focus group research or more survey research, is figure out what makes a difference here? What are the factors that make a difference? And then also get into media use. Messages, and what kinds of messages resonate? As part of your initial efforts, you're probably going to have to brainstorm and think, well, let's think creatively. What kinds of messages might resonate? And then how well will those messages fit those different social media channels? Will they work in those channels, not work in those channels? Or if I want to use a social media channel, sometimes you may decide, I want to use a channel, and then you got to figure out, okay, now how do I make it work? Other times you might be more open-minded and say, well, I'm going to take a broad perspective and then figure out which channels come later. And so that's the kind of thinking you want to be able to go through in terms of, so when somebody says to you, let's use social media, a lot of what you get is let's use social media, but you then have to do the hard part, which is the really critical thinking, the deep thinking, the brainstorming, throwing things up, seeing if they work, doing some pilot testing. You may decide, a good likely outcome is you may have to try some stuff with a small group of high school students and see what happens. Does this idea that you think is going to really work, bring in 10 high school students and try it with them and see what the reaction is. And you may find, yes, it works, or no, it doesn't work, or it'll work better if you do this, this, and this. So. Questions? Yep.
Have you seen any effect on traditional media from your use of social, like either good or bad, like more people going and reading a news article on the CDC because they were on Facebook?
Yeah, I mean, there's been a lot of effects. I think one is you see a lot of newspapers, things that I grew up with, things that I still get in the driveway every morning. Most of the information is now migrated to online. You see a lot of newspapers trying to make their content online more interactive and more engaging. You see a lot more multimedia platforms, and so you now have like the Associated Press, which never did video. They will bring cameras to CDC, and they'll interview people, and so in addition to the 400-word print story, they will come up with a short 2 or 3 minute newscast. And many of them are actually shorter, about a minute. And again, why are they a minute? Because they're finding that that's about the attention span that people have that they're willing to devote to these things. And so really short. That also impacts us as an agency. It means that our messages to our scientists and our doctors and our programs about you need to be short, we mean it. I mean, you can't have, a 7-minute podcast. It's maybe for some of your colleagues who are really into that, you can get away with that, but if you're trying to reach a broader audience, you probably can't do that. We embed links in our press releases. And so we send out our press releases electronically, and as a result of new media, we have links in our press release to take people to previously published studies, additional resources information, because we know that many reporters don't have time to do even a Google search. And so if we can help them quickly access additional information, we do it that way. I've seen a lot of newspapers, the Atlanta Journal-Constitution is one of them, that is asking its reporters to have Twitter accounts and to develop followers. And I heard the other night that they're even setting quotas into how many followers you should have as a reporter, because they're trying to build audiences, and they're trying to build viral capacity. And obviously a pretty artificial way, because if you put pressure on reporters to come up with 100 followers, what are they going to do first? I mean, friends and family, and then get their friends and family. So it may work in the short term, but it probably is not. So you're seeing those kinds of things happen. Facebook, agencies like CDC using Facebook where 2 years ago, 3 years ago, we probably wouldn't have made those investments. And so I think in a number of ways. And then I guess YouTube is the most ubiquitous. A lot more people creating video and trying to figure out how to use video and how to use it effectively. Really challenging because it's easy to do low-cost video where you have a talking head stand in front of a camera and do something. But if you think in terms of your own media usage, if you go to YouTube, how many YouTube videos do you watch that are talking heads in front of cameras? Probably not many, right? And if it is, the reason you're doing it is because they're really interesting. They got really compelling content. They're holding your attention. And so there's something else going on that makes that work. Other questions or thoughts? Yeah?
My class is not very interactive.
It's late in the day. I can understand that.
It is. Well, I want to thank you very, very much for being here. I have
Sure.
some J School swag for you. And there's some goodies in there.
Oh, well, thank you.
Your very own poster. And I also have the mounted one for you, too, so you get two.
Thank you.
Thank you very, very much.
Thank you.
Very appreciate it.
Thanks.
You're a big